TEPEZZA is a prescription medicine used to treat TED, no matter if you've had TED for months or years. TEPEZZA may cause infusion reactions. Tell your doctor right away if you have high blood pressure, fast heartbeat, redness of the face or feeling hot, difficulty breathing, headache, or muscle pain. Please stay tuned for additional important safety information later in this video.
What it meant to me to have the treatment option of TEPEZZA is it made me grateful. I was so grateful there was a treatment that could potentially make my thyroid eye disease better. My name is Jackie. I like painting, I like watercolors, I like to paint nature, and I just kind of paint my feelings. The TED symptoms that I experienced was eye bulging and double vision. I actually went to my regular optometrist, just thinking I, had contacted something, touched my eye. My eyes started progressively getting worse, and I said, should I go to my ophthalmologist? I didn't know what was happening. And then when he kind of talked to me about thyroid eye disease, I was like, what is that? Like, what do you mean thyroid eye disease? I've never been sick. It was very scary. My ophthalmologist, he had an endocrinologist that he knew, and the endocrinologist had heard about a treatment called TEPEZZA, and then he had worked with a neuro-ophthalmologist in his career and actually sent me to him because he was more familiar with that treatment. But after discussing, we felt that TEPEZZA was the right option for me. I felt like it was the right medication and to make my symptoms more manageable. After I completed my 8 infusions, I noticed that the proptosis that I had improved, and also the double vision that I was experiencing. After completing TEPEZZA, I was able to get back to some of the things that I was doing prior to getting thyroid eye disease. I did experience side effects. I had the leg cramps, I had nausea, I had hair loss. I was still seeing improvement with my TED, and that motivated me to keep going and to complete the infusions. With thyroid eye disease, you really want to isolate. I think it's super important never to give up. This is a disease, but that disease does not define us. We're actually the same person. So it's kind of like the me that no one sees. Today, my symptoms are much more manageable. It's much more manageable than where I was, over 5 years ago.
Important safety information. What is the most important information I should know about TEPEZZA? Infusion reactions can happen during or within 24 hours after your infusion of TEPEZZA. If you have a reaction while receiving TEPEZZA, your doctor or nurse will slow or stop your infusion and treat your reaction. If you have a severe infusion reaction, your doctor may stop your treatment completely. Tell your doctor or nurse right away if you have any of these symptoms during or after your treatment with TEPEZZA. High blood pressure, difficulty breathing, fast heartbeat, headache, redness of the face, feeling hot, muscle pain. TEPEZZA may worsen inflammatory bowel disease, IBD, such as Crohn's disease or ulcerative colitis, even if you don't have a diagnosis of IBD before starting TEPEZZA treatment. Tell your doctor right away if you have worsening IBD symptoms, which may include diarrhea with stomach pain or cramps, blood in your stools, sudden urgency to have a bowel movement, or feeling like you need to have a bowel movement even when there's little or no stool to pass. TEPEZZA may cause an increase in your blood sugar. Before starting treatment with TEPEZZA, tell your doctor if you are currently being treated for diabetes, know your blood sugar is high, or have been diagnosed with diabetes. It is important for you to take your treatments and follow an appropriate diet for glucose control as prescribed by your doctor. TEPEZZA may cause severe hearing problems, including hearing loss, which in some cases may be permanent. Tell your doctor if you have any signs or symptoms of hearing problems or changes in hearing. Before receiving TEPEZZA, tell your doctor if you have inflammatory bowel disease, Crohn's disease or ulcerative colitis, are currently being treated for diabetes, have been diagnosed with diabetes, or know your blood sugar is high, are pregnant or plan to become pregnant, TEPEZZA may harm your unborn baby. Tell your doctor if you become pregnant or suspect you are pregnant during treatment with TEPEZZA. Women who are able to become pregnant should use an effective form of birth control, contraception, prior to starting treatment, during treatment, and for at least 6 months after the final dose of TEPEZZA. Are breastfeeding or plan to breastfeed? It is not known if TEPEZZA passes into your breast milk. Talk to your doctor about the best ways to feed your baby during treatment with TEPEZZA. Tell your doctor about all the medicines you take, including prescription and over-the-counter medicines, vitamins, dietary, and herbal supplements. Know the medicines you take. Keep a list of them to show your doctor and pharmacist when you get a new medicine. What are the possible side effects of TEPEZZA? The most common side effects of TEPEZZA include muscle cramps or spasms, nausea, hair loss, diarrhea, feeling tired, high blood sugar, hearing problems, taste changes, headache, dry skin, ear discomfort, weight loss, nail problems, and changes in menstruation. This is not a complete list of all possible side effects. Tell your doctor or treatment team about any side effect you may have. You are encouraged to report negative side effects of prescription drugs to the FDA. Visit www.fda.gov/safety/medwatch or call 1-800-FDA-1088. Please see full prescribing information or visit TEPEZZA.com for more information. Talk to your doctor to see if TEPEZZA could be right for you.